Thanks for coming today. I'm super excited to see quite a few of you attending. And this is our second iteration of this presentation. We did this last year as part of the Health 101 classes. And this year I've added a few more things to align with your theme-mester. And I think this is the second in a series. So just kind of by a show of hands, how many of you guys were able to attend Dr. Martin's presentation? You can either raise your hands like this, or you can raise your hand with the, or with the perfect. Okay, so it seems like a few of you got to see that. So hopefully this will build on what you talked about in that presentation, and things will start to sound familiar to you. These may be things that you've already thought about. But what we're going to talk about today, all those things I asked you to when we changed our names, I said, let's look at things that impact health. And a lot of times we have a tendency to think of those things like genetics and our personal habits, like smoking and what we eat. I put junk food, but what if I told you that your zip code affects your health a lot more than your genetic code and a lot more than the personal habits that you make? So I kind of like to start this off. This is what I did last year. What if your birth certificate had an expiration date? Because in a way, it kind of does. So let's take Big Blue. If he was born right here in Norfolk, which Big Blue actually came on the scene at ODU in 1971, and I did Google this, so this is pretty accurate. That lion cubs weigh about 3 pounds when they're born. But if he was born right here in Norfolk General, how long would Big Blue live? So I looked this up on the life expectancy chart, and in the United States, the average life expectancy is about 78 years. Right here in Virginia, we beat that a little bit, so we're better off than most states in the average. We're in Virginia, it's 79 years, but in Norfolk, that's not quite as high as the rest of the state, 75 years old. So if Big Blue, if his birth certificate had an expiration date, it would be 75 years from that time that he was born. But let's look around. I mean, that sounds pretty good. I'm kind of happy to live in Virginia, that maybe are the United States, that I'll make it to about 78 is my hope, thought, or 79. That's not true across the whole United States though. My home state, if you look at the color outline here, you'll see the darkest colors are the longest life expectancy. So some in those states, or their average life expectancy is in the 80s. My home state of South Carolina, those in red. So maybe if I was born in South Carolina, if I continued to grow up there, the chances of me living to 79, like it's here in Virginia, are a little bit less. It's more likely that I would live to be about 75 if I continued to grow up in South Carolina, my home state. With Mississippi being to me, that's a little bit unbelievable that Mississippi there, the life expectancy is the lowest one, 56 years old, if you can see that. Can you guys see that in the graphic on the bottom? The average life expectancy is 56 compared to Virginia, where we're 79. I mean, why is that? We're all here in the U.S. Hopefully, theoretically, with opportunities that are similar. Maybe not. So that's something that we want to talk about today as we get further along. Right now, I'm just showing you the disparities. But to me, that's a little bit. I'll tell you that I'll be 55 next month. So that's a little alarming to me, because I feel pretty young in my mind. I know to you guys, I probably don't seem particularly that young, but to think that if I were in Mississippi, my birth certificate might be expiring next year. So just a few other things to look around. We'll get through these quickly and then get to some other things. But a county that I visit pretty often, McDowell County in West Virginia, has one of the poorest counties in the country. Their life expectancy, if you look on the left, is about 68. Again, compared to the US, where we're 78 or 79, or the whole state of Virginia, 74. A big difference right there within the same state. But if you look at North Carolina, we've got Wake County, that's just south of us, a very affluent neighborhood. And compared to McDowell County, very resource limited, very poor county, 68 years old, compared to Wake County. And that's only a drive of maybe 8 hours. So 8 hours difference in where they live. And they've got a gap of about 12 years there. Does that surprise anybody? Or did you, in Dr. Martin's lecture, you started thinking about all these social determinants of health, and maybe this wasn't as surprising? So even bigger than, you can pull up a lot of these. There's a, if you guys want, I can share this later. There's a website that you can type in your zip code and you can get what the life expectancy is for your zip code. But to me, this is even more surprising. So this is just one neighborhood. We're not talking about an 8-hour drive. This is one neighborhood. And look at the gap in life expectancy in this one neighborhood. If you live in these, in the darker shaded areas, your life expectancy is about 60. Well, not, I shouldn't say neighborhood, I'm sorry. Between neighbors. So these are neighborhoods that might be, you know, to use a language we sometimes hear, on two different sides of the tracks. So look at the life expectancy, age 60 compared to 90, right there in Chicago. So just, you know, right in the chat box, tell me just your guess from maybe Dr. Martin's lecture, or if you watch Place Matters, if you were able to watch that for homework or looked at some of the community vital signs. What do you think are some of the differences if we could overlay other maps and other maps that had data or something like that? Like one of the reading things I asked you to read ahead of time was looking at community vital signs. If we overlap that with Chicago, the areas where you're not living as long, what else do you think is going on in those areas where maybe your life expectancy is lower? What other things might they be lacking? Or if you had some data, I'll just give you an example, like one that Leanne put, lack of food. So what about grocery stores per capita? Good chance they're less in those areas where life expectancy is lower. Or maybe even percentage of people that are eligible for free and reduced lunch. So any more in the chat box, what else do you think might be different in those neighborhoods? Water isn't good. Thanks, Amanda. And we're going to talk about a little bit, Amanda not having money, Barba. We're going to talk a little bit about water usage later too. So thank you for that. But sometimes water supply, poor living conditions. Do you have not only safe housing? So is it safe? Is the neighborhood safe? Is it also, you know, what's the, if we could do statistics on the crime rates, that might impact your life expectancy. Cost of medical care, thanks pollution, Tessa. Cost of medical care, and along with that, what about access to medical care and access to quality care and transportation to medical care? Do you have transportation systems? So there's some, so we'll get to some more in a little bit. In fact, actually on this, in another slide, we're going to do a drill like that one more time. So be ready with your neighborhood. Start thinking about things in a neighborhood that might impact your health, and we'll do those again in a minute. So I just want to show you, though, a global view of life expectancy. You guys remember in the earlier slide, we said the life expectancy in the United States is around 79, 80 years old. In Central African Republic, the average life expectancy is 52 years old. For women, a little bit higher, 55, but for men, 50. Now, to me, that's, again, unbelievable, because I'm going to be 55 next month. So if I were born in Central African Republic, if that were my zip code, I probably wouldn't be here today to be able to present to you guys. So other areas, Sierra Leone. Now, some of the country like Afghanistan is actually on this list too, and I'm not sure why. I think this one's a little bit older, but Afghanistan, if you guys are reading the news and you know there's a lot of turmoil in Afghanistan, some things that decrease their life expectancy are civil war, things like that. But also, you might remember with the Afghan refugees, when we were evacuating, there was a big case of measles outbreak. So all you guys had access to measles vaccine whenever you were kids. And in fact, you not only had access, but you had to take them to go to school, and you had to take them to come to ODU. And in the United States, we've had measles eradicated for years. But in other countries, that's not true. It might surprise you that one child around the world dies every 20 seconds from a vaccine preventable disease. Every 20 seconds from a disease that you've been vaccinated against. So, and those are children that don't have access to those same vaccines like measles, mumps, rubella, polio, that are routine for us and easily accessible. So that's something we're going to add on to a little bit later too. So What do you think now? This is where we're going to go back to the chat box. I was going to try to do a whiteboard, but it was hard to switch. I was hoping you guys could write on the whiteboard, but it's really kind of hard to switch back and forth. But what are some of the factors that impact health and longevity? And I'm going to give you kind of a visual. So if you're looking at, if this were your neighborhood, if this were your zip code, just looking at some of those pictures, what are some of the things that actually would either improve your health or maybe impact your health negatively, positive or negatively? What do you see that that would impact your health if you lived here? In the chat box again, I guess, because there's a bunch of us, so I guess it would be hard to just shout out loud. So. There we go. Yep, I see smoke from the factories, the grocery store. Yep. Where is the grocery store? We're going to assume hopefully one of these is a grocery store, but is it there? Smoke from the factories. We see a lot of air pollution. What else do you see? There's a lot more on here. So we got to dig a little bit deeper. Everybody needs to find at least one thing. The hospital. So I see a big H right in the middle. So hopefully there's there's access to hospital, and right in front of the hospital, we see an ambulance. So hopefully they've got ambulance services. So that matters. I mean, even right here in Virginia, if I live in urban Virginia, there's a disparity between rural areas and urban areas. So if I called the ambulance to take me to the hospital right here in 757, we're probably going to get a response pretty quick and get to the hospital pretty quickly. But if I'm at my, if I'm at, we go to the lake at Lake Gaston, I had a friend there that had to call an ambulance. 30 minutes later, they were at a hospital. So totally different. Power and technology, Sydney mentioned, psychological state, Sydney said. And one other thing about power and technology, that's a good one, Sydney, but let's also think about the digital divide. Digital divide, like even right now, you guys are able to access this because you have either computers or phones or iPads or something, and you have internet service so that you can get online and you can have an education, and you can have maybe even you can participate in telehealth. And if you don't have internet service, that's not possible, either because you yourself don't have those devices, or what if internet doesn't make it out to your neighborhood or to your country? A bus from Oreo Brittany. So yes, transportation. And that bus might get you not only to your doctor's appointments, but what about to a job? So a couple of things I don't see you mentioned. Anybody see that little bicycle down in the left corner? Are there exercise trails? I see people walking. There's a study that I read in a physical therapy journal that this looks like a city, right? Typically people in cities actually live longer than people in rural areas. Now, even with that air pollution, that might seem counterintuitive, but you have to walk a lot more in the city. So you automatically exercise more. You also have access to oftentimes more jobs, bigger jobs, higher paying jobs. You have access to the hospital, things like that. So we're going to assume some of these buildings relate to jobs. Anything else that we missed? See a few more. Let's say, what about recreation? Well, are these hot air balloons? Is that recreation? I don't know if that counts as recreation or something else. What about this visual tower? Just recreation, opportunities to relax. Where the power lines are, that can make a difference in that. And even if, oops, I didn't mean to go backwards. So you guys have already seen this slide, I think, if you looked in your reading materials, or if you were able to meet with Dr. Martin. But these are some of the things that we can categorize what we just talked about. So economic stability, if we went back to our slide before, and we were looking at some of those buildings again, we said those might translate into jobs. So unemployment rates might be something that would be a community vital sign. If a lot of people in one community, if we think back to that Chicago neighborhood, if some of those darker shaded areas where the life expectancy was lower, what is the unemployment rate in those neighborhoods? What is the income, average income in those neighborhoods? What types of jobs do they have? Just look at me right now and the job that I have. So I'm going to tell you that I went into, let's do nursing first. I'm going to be nursing biased. I know you guys are all health sciences, but I'm from nursing. But you can do your whatever major that you're looking at. But thinking about nursing, what are some of the job hazards of being a nurse? Just when you think about it, what are job hazards of being a nurse? And if you're dental hygiene or environmental science or whatever your major is, what are some of maybe the job hazards of that particular job? So back to the chat box. Bloodborne pathogens. Yes, that's one we think about right now, Rebecca, for sure, because we're thinking about COVID and some of the spread of disease with COVID. So nurses have really been in the news a lot. Sitting too much was, thanks Leanne, and sitting too much was one where I was going to tell you guys that I went into nursing so I would have a job, so I wouldn't have a desk job, and then look at me now, I'm sitting all the time. So they say sitting is the new smoking. If you're sitting too much, that's a bad habit and bad for your health. Radioactive, yeah, certainly in nursing, but also if you're in some of the other, oh, what is it? Help me out. Scott's major.
Nuclear medicine.
Thank you. Nuclear medicine, nuke med, thank you. So getting a needle stick. Thank you for that, Anna. And you know, even a needle stick might matter by zip code. That's a very good example, because here in the US, we have very few needle sticks, but in Central American countries, the rate of hepatitis in healthcare workers, which is a risk from a needle stick, is about 12% higher than the average population. So Anna, I'm gonna put you on the spot then, since you mentioned getting stuck by needles, and I helped you out by saying, okay, that puts me at risk for hepatitis or HIV or other diseases. What do you think might be different between the US, and anybody else that wants to answer, between the US and some of the resource limited countries, and why their needle stick rates would be higher? Just a guess. So it does matter if I'm a nurse in the US or if I'm a nurse in maybe El Salvador.
I think for the people who have limited resources to things like needles and things, they might even be using one needle for like 10 patients. But for here, we have a lot of it. We have supplies coming in every single day, so we can change needles every single time. But some places they don't have that.
All right, thanks, Anna. So and the countries I've been to, like El Salvador, they have progressed to where they are changing needles. But your point of resources is an excellent point, because here's what I've seen. Now, you guys maybe know that I've taken study abroad groups to Guatemala and El Salvador and things like that. What I've seen is they don't have some of the safety equipment that we have. So if you're a nurse starting your new job and you go out to give someone a vaccine, then one thing that's an absolute rule that you know is we don't recap. So that's often when you get a needle stick, is you stick somebody in the arm and then you put the needle back on and you miss and you stick yourself. Well, we don't do that because in the US, we have safety equipment where, if you guys have gotten some of your vaccines lately, you know that they have some of those cool things where the needle retracts into the syringe, or it has a cover that automatically goes over it. Well, when I started in nursing, we didn't have that, but now we do. So I've seen in some of the more resource limited countries, they don't have some of those fancy needles that have that safety equipment, or they don't have even the equipment boxes that we put them in. So I've seen needles stuck down in coffee cans. So instead of you guys have seen the red boxes on the wall or something when you got your vaccines that they put them in. So safety equipment is different. So thanks. I'm struggling to read the chat box and not move my screen. That's what I keep having trouble with. But all right, so let's go. Let's see if I can get to the next slide. So here's some examples then. Thanks you guys for participating. I really appreciate that. Here's some examples that align with all those headers we looked at. Now, this isn't all of them. You could certainly add some more, but we talked about under the economic stability, employment, we mentioned income. What about expenses? If you're having to take public transportation every day, that might be actually an expense and a time concern too. Debt, medical bills, in your neighborhood, housing, somebody already mentioned that, transportation. We talked a little bit about safety. I saw somebody mention, what if there was use of drugs in the neighborhood? And that might either influence you to use drugs, but it also might bring crime to that area. So is it a safe area? Parks and playgrounds, are there places to walk? So look at some of these others: food, access to healthy options. I changed my name to Junk Food Janice, and you could have made an assumption that I was referring to choosing to eat a lot of junk food. But what if, rather than choosing to eat the junk food, I didn't have a choice because that's all that was really around or close to me? So let me give you another example of that. Grocery shopping in a rural area of North Carolina, and I don't mean to be picking on any areas. We're just talking about the difference in resources. But we wanted to go to the grocery store to get a red bell pepper. Does that seem pretty common, a red bell pepper? I mean, I know I can get that in any grocery store that I walk into in my neighborhood. So I live in Chesapeake and Great Bridge, and red bell peppers are just going to be in every single grocery store. And my husband was actually with me. He said, "You're not going to be able to get a red bell pepper in the grocery store. It's a small grocery store, rural area, not a lot of people that shop in that grocery store." Well, sure enough, when we went into the grocery store, there were no red bell peppers. One thing that was on the end cap of the grocery store was fatback. Now, again, I told you I grew up in South Carolina, so I'm very familiar with fatback. That we used to have that for breakfast. If you don't know what fatback is, it's kind of like, it fries up a little bit like bacon, but a lot fattier. And that was an entire end cap. I've never seen an end cap like that in the grocery stores where I normally shop in Great Bridge. So big difference there, maybe between food choices and preferences, but also between food availability. So just a big difference in what you can choose to get. And things like fast food options. Have you guys been through neighborhoods that there's more fast food restaurants than other restaurants? So that makes a big impact. So here's just a few examples. If you're, I just want to show you what this might look like. How much longer will a 55-year-old man live by income? So this graphic is to show you that if you're in the richest 10%, then if you're 55, you might live another, if you're born in 1940, you actually lived another 29 years. Or another, if you're born in 1920. But if you're in the lower percentage, then look at the difference in that life expectancy. Any surprises there? This graphic, and this can be a live graphic, but this graphic shows by country some of the life expectancy in the by income. So high income are the ones that go up to the right, and then life expectancy goes up this way to the left. So income and life expectancy. And you'll notice how they align. If you're earlier, we looked at like Somalia, and they're a low income country, and their life expectancy is around 55. So notice that the US is not the highest. So yeah, even by ODU, not a lot of food choices that might be healthy choices. Life expectancy by birth by education. So congratulations to all of us here. Just by being in college, you guys are increasing, you're changing that expiration date on your birth certificate. Now, if you look at this graphic, you'll see that the red line indicates higher levels of education the red line is 2008. Look how much your life expectancy goes up if you have higher levels of education. So there's another. We talked already a little bit about, we mentioned sitting jobs and nursing jobs, and some of the things you might be exposed to for job hazards. So if you're a college teacher, well, lucky us. I might make it to 82 years old. That's pretty good. A lot different though if your job is as a butler or a waiter. And so different life expectancies based on what your jobs are. So one more, did you guys notice on that? Let's go back, let's look at this. So looking at this again, look under the community and social context. The fourth one down, discrimination. Does that one seem like one that would have to do with health? So I went to, this is what we're going to talk about for about the next 3 slides. In the US, about 700 women die each year from pregnancy complications. But if you're American Native, Alaskan Native, or Black, it's 2 to 3 times higher. So if you see the graphic, now why is that? You know, do we think that is genetics, or do we think that might be some more of those social determinants of health that we looked at? So it could be related to some of those levels. Some things we talked about could be related to diet. It could be related to genetic coding. It could be related to education, like we mentioned. But what if it's related to actually racism? Not just race, but racism. So I was about 2 or 3 years ago, ODU sponsored a guest speaker who was a journalist, Linda Villarosa. She's a journalist, and she wrote this article that was published in the New York Times. I think this is a Pulitzer Prize winning article. Why America's Black mothers and babies are in a life or death crisis. And she explained her own experience with pregnancy and childbirth and the racism that she experienced when she went to the hospital. So she is, I think she has a PhD in a higher income bracket, lives in super nice neighborhoods. So all those social determinants of health that we talked about by neighborhood, she is in a different category, but she's Black. And Serena Williams was another example of that. Very high income, exercises all the time, and had, almost died during childbirth. So what is it about that with these women that might impact that? And so one concept that she introduced me to that I'd never heard of before, and it's actually been a term that's been around since like 1992. And even as a nurse, I've been a nurse for 30 years, and this was not something I'd heard of. And the term was called weathering. And the way she described weathering is in the same way that a house, if you have a house at the beach, and over time it's impacted by the sand erosion and the wind erosion and the storm and the rain. And over time, that house starts to wear down and the paint's gone and the wood starts to rot and the foundation maybe it had some flooding, and that house starts to wear down, and over time it deteriorates. Well, the way that she described weathering was that the microaggressions that minority women experience over time start to wear down their health. So that if they are, maybe there's assumptions, even microaggressions, that there's an assumption that maybe they're not as educated, or there's an assumption that, I can't think of another example, but those types of microaggressions are even not just overt, but covert racism starts to wear somebody down over time, and it impacts your body systems so that it impacts your health. So take a look at this here, and this is in the US. Now we already said the life expectancy in the US is pretty high, but what if you're a Black male in the US? Your life expectancy is significantly lower than mine is as a white female. So over in nursing school, I definitely have known, everybody that's a nurse knows, and you guys may even know, that if you're a Black male, you're much more likely to have hypertension. So your rate of hypertension your chance of having hypertension might be about 50% compared to me as a white female that might be more like 27% of white females have high blood pressure, and Black men about 50%. So your chance of dying from a stroke pretty young is a pretty common phenomenon. Well, there may be some genetic factors that impact that, and certainly some of those socio determinants of health. But what if it is that chronic stress of racism that impacts that? So these are an overall goal. Has anybody ever seen this before? Is this familiar? Do you know what the Sustainable Development Goals are? So Sustainable Development Goals are basically all these things that we've been talking about that factor back into health. So we mentioned education. We mentioned equality. So we mentioned water. Somebody mentioned water. Water's number 6 there. And if you take all these and then put them in a circle and put health in the middle, water impacts health. Your level of education impacts health. Then if we can impact all of these things around this circle, then we can impact health. So we could actually increase our life expectancy. So just an example of that, we mentioned no poverty is number one. A lot of people did your name as low income or poverty or things like that. If we could have every country in the world have no poverty, then we probably wouldn't have countries that had life expectancy of 55. So if we could address that and make that a little more equal. Gender equality. Now, women do tend to live a little longer than men, and in most countries that tends to be true. And when we think of gender equality, we normally think of women as coming up on the short end of the straw there. So oftentimes women are paid less for the same job. They don't have the same access to school. I did a mission trip to Ghana one year, and we visited the schools, and in the school system, only about 25% of the kids in school were girls. So a lot of those girls were at home taking care of household chores or had other reasons that they couldn't come to school, sometimes just for lack of feminine hygiene products. That's one thing that in Ghana that keeps keeps young girls at home, because they can't go to school if they don't have a way to be hygienic during their monthly cycle. And so they have to stay home for 5 or 6 days during that time. Clean water and sanitation. One more fun one. We're getting close to the end here. I hope I've surprised you guys with some things. And I hope we come up with a few things that we can address. But here's one more I like to do. Water, we already mentioned, is something that impacts health. So access to clean water. Right here in the US, you guys might be familiar with areas that we've had high rates of cancer. If you've watched that Aaron Brockovich movie, I know that's an old one, so you can go look it up and find it on Netflix, but it's a county in Flint, Michigan, where the factories were dumping water into the lakes and river, and they had a high level of deaths in that area and high rates of cancer just in that area. And in that movie, we have a lawyer, Aaron, it's a true story, great movie, go look it up and watch that. But related, we can have water problems even right here in the US, but certainly in other countries that don't have the sanitation rates that we have, it's oftentimes that the water that you're drinking is just right downstream from the water that's close to the urinals and things like that. Here's the one more thing for the chat box. How much water, so don't Google, no Googling. How much water per person and liters do you think we use a day in the US? So put the US first, and then put your guess for Haiti without Googling. And let me do a disclaimer. This is for everything. So not just water we drink, but water to take a shower, water to brush our teeth, water to run the dishwasher, water to wash our plants and also our agriculture, water that we use to wash our cars. How much water do we use per day, per person per day in the US, and then compared to Haiti? See if we're getting some guesses in here. And I see Leanne's putting some areas we can look up and get some reports, income poverty. Any guesses? Yeah, how much water per person in the US? 500 compared to 200. All right. Thanks, Amanda. Any other guesses? Let's get a few more in there. 300 compared to 150. So, so pretty good guess. We know the US is higher, right? Or we're making a good guess that the US is higher. What's some other guesses? I've never had this. I like to do this like when I'm in a, when you need an icebreaker and you're having some, maybe you're meeting some people for the first time. This is one of my favorite questions because no one ever gets it close. So that was probably a hint for everybody else that hasn't guessed yet, right? Give me a few more guesses. $250 versus 90. Maybe getting a little closer. Y'all ready for me to go to the next slide? All right, this is gonna surprise you, I think. Maybe not, I don't know, Brittany and Leanne, if you were here last year, maybe not you guys, but I think it's gonna surprise everybody else. Any more guesses? We should have done this for the prize. Whoever gets the closest, this should have been the prize. Look at this, per person per day, in the US, we use 540 liters of water per person per day in the US. Now remember, that is agriculture and things like that. In Haiti, I gave Haiti as an example because I've been to Haiti rather than Mozambique, but in Haiti, it's around 10. Now I'll tell you, in Haiti, when we went there, water actually weighs 8 pounds a gallon. And who do you guys think fetches the water? Any guesses on that? Who has to go get the water? Usually the women, and a lot of times the children. So I've got 4 kids. If I was the mom of the house and I had to go get the water for my 4 kids, and thankfully they're grown, so they can go get their own water now. But if I had to carry 545 liters a day times 4 kids, I mean, I'm picturing Costco. I have a hard time with just that, with that big thing of water bottles that we get sometimes. So what if I had to carry all that water? Water actually causes hazards of, it weighs 8 pounds a day. So over time, if I'm carrying water every single day, and I have to walk sometimes a mile to go get that water and carry it, a lot of times on my shoulders, my head, I'm going to have back musculoskeletal issues. What else am I subject to in that mile walk? Any other things that might impact my health? I might be subject to attacks, sexual predators, animals, things like that. The other thing that happens with carrying water too is that, oh shoot, I forgot where I was going with that, but it is usually women and children. They have come up with some innovative ways to carry water. Oh, I know where I was going to head, totally different. But in Haiti, when I was there, to avoid carrying that water, they've been pretty innovative. Every time it rains, every corner of their house has a bucket under it. So they're going to capture some of that water so they don't have to carry that. So if you just Googled online and looked at like housing in Haiti, you would find that most of the houses have areas where it runs off. And, you know, sometimes we do this in our sort of green zone houses, but it runs off and then filters down into a bucket. Maternal mortality is down 45% globally since I've been in nursing school, but this is one of the areas that we're working on. I probably actually should have had that. I got those slides out of order. I should have had that back with the women's slides that I was talking about, but we still have a long way to go. And then here's where I wanted to get to one thing you guys could do today. Global under 5 mortality rate has dropped by 59% since I've been in nursing school. So 30 years that I graduated, it's dropped by 50%. So to tell you what that is, when I was in nursing school, 1 child died every 11 seconds from a vaccine preventable disease. Now that's not the only thing that kills children, but that's just another example. Every 11 seconds, 1 child died from a vaccine preventable disease. Now it's every 20 seconds, but that's still 1.5 million children every single year. And they're dying from diseases that we have vaccines for. So do any of you guys know anybody that has polio? I did, but you guys don't, because polio has been eradicated from the US since the 1940s. It's not eradicated from the world. It's still actually left in the world. It's almost eradicated in the world, but it's still in the world. It's only in 2 countries. This would be, if anybody could guess that, you would definitely win the prize. But 2 remaining countries still have polio, and that's Afghanistan and Pakistan. And we're having trouble getting into those countries because they are a little war-torn with our immunization clinics to vaccinate those last kids. But the thing about polio is if we can get rid of it, it goes away forever. It can't come back because then there's no way for it to transfer from person to person. Or, you know, person like another example of that is actually smallpox. So none of you guys that are watching this video, I'm going to make a guess there. I don't think any of you guys actually have a smallpox scar. So does any of your parents have a smallpox scar? That could be possible. Natalie does. Are you in the military, Natalie? You have a smallpox scar. Were you born
in Vietnam? I was actually born in Vietnam, so.
Born in Vietnam. So, all right. So you're the you're the only one on the, I'm going to guess you're the only one on here that has a smallpox vaccine. Although smallpox has been eradicated even for your age group. is still eradicated from the entire world. So there's no such thing as smallpox in the world anymore. So the only people that have tend to have it is if they were traveling in a different country, like a lot of our military, or if they're a little bit older. So normally have to be about age 60 to have a smallpox scar. And then thanks, Liam, for that question. What did I say, 40s? So 50s is when polio was eradicated from the US. So what I want to tell you guys is if you guys wanted to be advocates for global vaccine programs, and I would imagine Natalie could really relate to this, if you have family that are still in another country, without access to vaccine programs, then the life expectancy rates are lower. But it also, you can see with COVID, it also impacts us here at home. So what happens with COVID if we can't, if we get everybody vaccinated here in the US, but then we don't vaccinate anybody in Somalia? Then they get COVID and then they travel back to the US and then we get it again. And it just keeps going on and on and on like that. So we have to vaccinate the entire world. And a better example of that might actually be measles that I mentioned. Measles in the US, we have our eradication letter for measles, and we've had that for several years, but we almost lost it in 2019. Because so when you have the eradication letter, that doesn't mean we have 0%. It means we have only a small number of cases that allows us to be under that level. And so we haven't had a measles problem in the US for years, but it is still around the world. And in 2019, a group traveled out of the country and brought measles back to the US. And now there's more people in the US that are hesitant to vaccinate. And so then measles started spreading around the US. So we came very close in 2019 to actually not having that eradication letter anymore. So it is very important that we actually help other countries get vaccinated too, so that because we travel. So a disease can travel around the globe in 36 hours. So getting to one action you can take, and I do want to clarify, I don't know where you guys, where your stand is on, I obviously have a bias. I'm a nurse. I'm 100% for vaccines. I think they work. But you don't have to be, you could still be nervous about the COVID vaccine and want other people to have a choice to get that vaccine. So the countries I'm talking about oftentimes don't have a choice to get those vaccines. And if you were a vaccine advocate, one thing you could do is you could actually text, and you could do this right now. You could do it tomorrow, but you could text 30644 and fill out the petition. And that's going to go, when you text that number, you're going to get back an email that says, okay, what's your address? Who's your representative? And you won't have to say who your representative is, the system knows, but you'll put in your address. And if I put in my address, then that means that Representative McEachin for Chesapeake and Senator Kane for Virginia and Senator Warner are going to get a petition from me that says, I'm your constituent out here, and I think that children around the world should have access to life-saving vaccines. So I think it's crazy that there are kids out there that are dying from things like measles, when a measles vaccine costs about $1. That's what it costs, about $1. So if we could just invest a very, 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 very small amount of money in vaccines, we could save a huge amount of lives around the world. So Shot at Life is a vaccine campaign program that I've been a part of for the last several years, United Nations Foundation. And through that, I've learned to go talk to my Congress members. I do this every year. You guys are welcome to come join me. I can send you an email and some invitations. I'm going to be meeting with Senator Kane's office and Representative McEachin's office on Thursday, October 14th, to let them know, hey, don't forget about, I've already talked to them before, but don't forget about global vaccines. It's important. It's important because kids are dying around the world, but it's also important because we just brought in refugees from Afghanistan, and if they're not vaccinated, they bring measles with them. So even if I want to protect my own self, if you want to look at it from a selfish viewpoint, we need global vaccine programs because they protect us right here at home. Global vaccine programs also mean that we might be able to, those girls that I talked about that weren't in school, if you're sick, you can't go to school. So if they have vaccines, if they have access to vaccines, they don't have to stay home because they're sick, because maybe they won't have that sickness. They can go to school. So now we've just increased their life expectancy. If you have vaccines, you can go to work. And we already know that your income level impacts your health. So all those things that could be impacted just by texting vaccines to 30644 is one area where you can make a difference on all those social determinants of health. So I think that gets me to the last slide. I would love to hear your questions and comments now if we want to. Let me do a stop sharing. And I know I've missed some of the comments. Leanne has helped me say, okay, eradicated for polio in the 70s and the vaccine in the 50s. So I was a few years off. And probably I should have realized that, Leanne, because honestly, when I started nursing school in the 30 years ago, polio has decreased by 99% across the world. So I probably should have realized. So good point, though. I made it sound like it was a million years ago, and it really wasn't that long ago. Comments, questions, anything that surprised you? Anybody want to get involved with Shot at Life? Would like to go meet with Senator Kane? Anybody want to hear more about that? Most interesting fact. That's a good one. What was one of your takeaways today? And if you'd rather not talk, because I know it's hard to talk over each other, you can do it in the chat box. What was there anything today that surprised you? Anything that you learned? Anything that you think you can make an impact on? That Haiti had uses 10 liters of water a day. Isn't that crazy? How could you possibly get everything done with that amount of water? High water usage in the U.S. So I'm actually up in Washington, D.C. right now instead of in Chesapeake. And out on the sidewalks here are little good things you can do. And one of them mentions turning the water off while you brush your teeth. So you turn the water on, turn it off and brush your teeth, and then turn it back on rather than leaving it running the whole time. Pregnancy complications for African Americans. Tessa, go read that article. I can't see Tessa. There you are, Tessa, on the screen. Go read that article about by Linda Villarosa, and then read about the weathering effect. She didn't actually invent that term. She referred to it. She's the one that taught me about it. But Arlene Germanio is the one that first mentioned that term. And then Google. I want to tell a couple more stories since Tessa mentioned that. The pregnancy complications for African Americans. I made a suggestion that might be due to not just their race, but actual racisms. After I went to Linda Villarosa's presentation, I started Googling. I said, oh my gosh, that's crazy how that, I just can't even hardly believe that. So I started Googling racism and maternal outcomes. And I found quite a few articles. Now I say Googling, you have to do like Google Scholar, or you have to go to the ODU library to find these articles. So I was looking for evidence-based articles. I was not looking for blogs or people's comments or places where you can find information. I was looking for actual research, but I found them. And here's a couple things that I found. After 9/11, there was a study that was done in California. And in California, they looked at records of women that gave birth in a town in California, and they looked at the records of women that had Muslim-sounding names. Muslim-sounding names, and they looked at preterm labor outcomes and low birth weight outcomes. And then they did, after 9/11, they looked at birth outcomes for women with Muslim-sounding names, and they found that statistically significant differences in the number of preterm labor deliveries and in the number of low birth weight outcomes. So you guys probably know after 9/11, and I know a lot of you aren't old enough to remember 9/11, but your generation has really been one that started to recognize things like Islamophobia that happened after 9/11. So the incidence of racial attacks on Islamics increased by like 20%. And I might be making up that number, just like I made a guess at polio eradication. It increased a lot after 9/11. And so those microaggressions that impacted the women in California actually impacted their birth outcomes. 6 months, just 6 months difference after 9/11. So one more example of that, very similar. There was in, I don't think I'm going to remember which state it was, but in the US, there was maybe in Ohio, but there was a community that had a high level of Hispanics in the area. And they did a immigration raid in that community to see if they could capture all the illegal immigrants that were in that area. So then they did a similar study related to, so you can imagine the stress to the Hispanic population after that ICE raid. They did a similar study on birth outcomes, and they found that the birth outcomes after the ICE raid for Hispanic women, whether they were legal citizens or illegal citizens, just because they were Hispanic, they had poorer birth outcomes, statistically significant poorer birth outcomes. So thank you, Tessa, for mentioning that, because I really wanted to mention that. Measles cost $1. Let me give you another comment on that from Madison. Madison, if we spend $1 on vaccines, we get $44 back in the return on the investment. Now, that might have been hard for me to try to explain, a couple of years ago, but now with COVID, we all understand that. Because guess what happened to COVID when we couldn't go to work? And guess what happened to COVID when we had to stay home and take care of children and couldn't work because they were being homeschooled? And guess what happened when we couldn't go out to eat during COVID and we couldn't spend money? The economy changed a lot with COVID. Well, those same types of things happen whenever you get measles, or you, again, like I mentioned, if you're sick and you can't go to work and you lose income and you're paid by the day or by the hour, then that impacts your personal income, which means you can't spend money, which impacts somebody else's income and the economics. So for every dollar we spend, we get $44 back in return investment. So if I'm talking to my congressman, I'm telling them that, like, hey, we can spend a few bucks on vaccines because we're going to get that back. So. Natalie, good point. Some people in the city live a lot longer because of walking around a lot. There are, did I finish explaining? I explained that with the study. That was a physical therapy study. They found that in the city that people accidentally get enough exercise to be healthy. They don't even have to try. So if I live in suburbia, I have to intentionally, and I sit at my desk all day and do things like this, I actually have to intentionally go to the gym or go for a run. But if you live in the city and you have to walk to the metro, or you have to walk to work because there's no place to park and it's too expensive to drive, you automatically get that built-in exercise. The level of obesity is a lot lower in the higher city populations than in other areas. So any other things that just kind of shocked you today? I don't know how to ask this question. Did I scare anybody? Because now do you feel overwhelmed because that you don't feel like there's anything you can do about it? Because I'd have to come back on and when we could do a whole other seminar on what can we start doing to impact these things. One big thing we can do is we can impact health policies, but we can also impact fair housing policies and safe housing policies. We can advocate for things like that. All of those things that impact health. We can, I know that you're going to have Dr. Hagelin come in next and talk about food deserts. We can advocate for food areas. Right here in Norfolk, there was a national article that made it on CNN about a grocery store that closed down, and it was the only grocery store within miles. Well, one just recently opened, but it took a lot of people that were civically engaged to get a grocery store back in that community. I'm sure she'll talk about that one.